Well, good morning and welcome to this distinguished speakers lecture at the Lowy Institute. We are delighted to welcome here today Mr. Michel Sidibé, the Executive Director of UNAIDS. When UNAIDS was formed in 1996, it was the first time a specific purpose UN agency had been formed to combat a single disease, or indeed a major global problem. The formation of UNAIDS indicated how grave the international AIDS pandemic had become and that extraordinary measures are required to deal with the challenge. It is sobering to consider the scale of the challenge we face with HIV/AIDS today. Since the beginning of the epidemic, almost 60 million people have been infected with HIV and 25 million people have died of HIV-related causes. The most recent 2008 figures showed that some 33 million people are living with HIV, 2.7 million new infections a year and 2 million AIDS-related deaths a year. In 2008, around 430,000 children were born with HIV, bringing to 2.1 million the total number of children under 15 living with HIV. Sub-Saharan Africa is home to 67% of all people living with HIV worldwide and 91% of all new infections among children. The epidemic has orphaned more than 14 million children in Sub-Saharan Africa alone. UNAIDS has provided crucial strategic leadership to the struggle against this terrible epidemic. It was complemented by the founding in 2002 of the Global Fund to fight AIDS, tuberculosis and malaria by the G8 countries. Since 2002, the Global Fund has raised some $19 billion of which about half has gone to HIV/AIDS care, treatment and prevention. Much of this came from traditional donors such as Australia, but also from new sources, notably the Bill and Melinda Gates Foundation. This international effort has slowly begun to pay dividends as the new caseload has stabilised and begun to decline in many, but not all regions. From early on, the Lowy Institute saw global health policy and the HIV pandemic as a serious challenge to the development and security of our region and our planet. In 2009, we created the Pacific Friends of the Global Fund against HIV/AIDS, tuberculosis and malaria. Funded by the Bill and Melinda Gates Foundation, it works closely with the Global Fund, UNAIDS, AusAid and other stakeholders to raise awareness of these terrible epidemics. On the 4th and 5th of October this year, a Global Fund replenishment meeting will take place in New York under the chairmanship of the UN Secretary-General Ban Ki-moon. The Global Fund needs $20 billion for the 2011 to 2013 period to fund the international response at reasonably adequate levels. I am sure Michel Sidibé will be discussing this as he attends the United Nations NGO conference in Melbourne and travels to Canberra to meet officials and ministers next week. Today, Michel will meet many of the people who shaped the Australian response to HIV/AIDS. Several of those people are present here today, and I welcome them. One who is not present with us today is Michael Kirby, who has recently been appointed by UNDP and UNAIDS as co-chair of the UNDP-UNAIDS Global Commission on HIV and the Law. The Global Commission also includes Charles Chauvel, who serves with Michael on the Pacific Friends of the Global Fund, and Dame Carol Kiru from Papua New Guinea, who is also a very good friend of the Lowy Institute. Michel Sidibé has been a tireless worker and an inspiring leader in the global fight against HIV/AIDS, especially in his home continent of Africa. He has been the Executive Director of UNAIDS and Under Secretary General of the United Nations since the 1st of January 2009. Mr. Sidibé's passion for advancing global health began in his native Mali, where he took up the cause of the nomadic Tuareg people. In 1987, Mr. Sidibé joined UNICEF in Zaire. In his 14 years at UNICEF, he oversaw programs across 10 Francophone countries in Africa. Mr. Sidibé became the director of the Country and Regional Support Department of UNAIDS in 2001. In 2007, he was appointed as UNAIDS Deputy Executive Director of Programs and Assistant Secretary General of the United Nations. Mr. Sidibé was named one of the 50 Personalities of the Year in the fields of science, politics and economics and civil society in 2009 by the newspaper Le Monde, and in 2007 was awarded an honorary professorship at Stellenbosch University of South Africa. He is a Knight of the National Order of the Legion of Honour of France, an Officer of the National Order of Mali, and was awarded an Order of St. Charles by Monaco. He earned two postmasters diplomas in social planning and demography, as well as in development and political economy from the University of Blaise Pascal, Clermont-Ferrand. He holds a master's degree in economics. Ladies and gentlemen, we have with us today one of the true visionaries in the global struggle against the epidemic of HIV/AIDS. Please join me in welcoming Michel Sidibé to the Lowy Institute.
Good morning. I am deeply honored, and it is a real pleasure for me to be here in this very, very important and prestigious institute, Lowy Institute. I want, if you allow me, to start by just thanking Michael and Bill for creating the opportunity for me to address you today and to have the conversation, because I call that a conversation with you on issues which seems for me one of the most important issues the world is still facing. Because it is not just issues of health, it is truly issues of social justice. It is issues of human rights. It is of issues of governance. It is issues of redistribution of opportunity. It is issues which, without any doubt, call us for making sure that people without a voice could have access to the world which we are building for ourselves, will have access to services and will not hide themselves, go underground because they are criminalized or because they are stigmatized, because they are rejected. I'm very happy to be with you today because we are at a tipping point in the fight against HIV/AIDS. It is indeed a time for us to reflect, to take a little bit time to look back and to see what we have been able to do. And it is time, after 30 years, to think if we need to reshape our response, if we need to recommit ourselves, to redouble our effort in the fight against HIV/AIDS. We are, without making you starting thinking that I am a too optimistic person, I think we are at the best of the times. But unfortunately, we are also at the worst of the times in the fight against HIV/AIDS. Why the best of the times? We are because we have been able, with you, to demonstrate that money can work for people, that we can produce results, just during the last 5 years, with a mechanism like a Global Fund, which is unique, we have been able to multiply the numbers of people on treatment by 10-fold. I said just during the last 5 years, moving from less than 500,000 people on treatment to more than 5 million people today. We have to recognize that during the last 20 years, we never managed to have any public health programs who have been able to go to scale so quickly. But we have not been just able to increase the coverage of people in need of treatment. We have been able to reduce the number of new infections by 17%, which means in absolute terms, we reduce or we averted 400,000 new infections in Africa only. We have been also able, because of this effort, to reduce the number of deaths by 10%. In some countries like Botswana, where a few years ago, people were telling me that, this country will not exist anymore in the map. In 2010-12, you will not have Botswana, you will not have Swaziland, because this country was having more than 30% of people living with HIV. 1 person out of 3 were infected. This country has been able to demonstrate that they can reach universal access. That universal access is not a dream for only rich people. That universal access can be possible even in the poor setting. They have more than 95% of people on treatment today. They have been able to virtually eliminate the transmission from mother to child. They have been able to reduce mortality by more than 50% due to HIV. That is the best moment we are in today. And I want to just say that it's not just by increasing the coverage, by reducing the new infection, but what we are seeing also is that young people can take the lead in prevention. We were considering them as just passive beneficiaries of our programs. In last year, the report I share, or this year, I share with the world, revealed clearly that more than 15 countries, the most affected and infected, we had a reduction by 25% of prevalence amongst young people. And it's not just because they were delaying their sexual relation, not because they were increasing the number of use of condom, not only because they were abstaining, but is because the social relationship between parent and child even changed because HIV. Sexuality education was something unacceptable in most of those parts of the world. And because HIV/AIDS, the parents today in most of those places are able to talk about sex with their children. Imagine a little bit a child in Papua New Guinea or in Mali sitting with his father telling him, you have to be careful. I don't want to lose you. I want you to know that AIDS is out there. And to protect yourself, you need to have this knowledge. That is a big change. That is the beginning of what I was calling for, the prevention revolution. And that is why I want to just say that we are at the best of the times. I was in Vienna, so happy to have a South Africa a research center, Caprica, who is a collaborating center of UNAIDS, coming and sharing their result with the world, telling us that they found microbicides, which can work for the first time for the women. It's the first time that we have a tool in the story of fighting HIV/AIDS in 30 years' time, which can help the women to initiate and to use a protective measures without having her to refer to any man. It's the first time. Circumcision, very good discovery. And we are happy that we could really help to go to scale with it. But protecting men, not women. Condoms, very important, and we need to continue to make sure that young people could use it. But in most of the traditional setting, the decision is a man. I use it or I don't use it. Female condom, the same, particularly in the region or the part of the world. It could be Pacific region, islands, or Africa, or different part. You will find that those tools are not used because the men, it is a decision of the men. So for me, it's so interesting to see that things are changing. Like I said, I just was in Papua New Guinea. I saw a change coming there also, due to your, certainly partly to your effort, the commitment of Australia, the resources, the leadership, the pressure you have been creating to make sure that the leadership there continue to have AIDS on the top of the agenda. We are seeing decline on the prevalence there also. We are seeing now the debate emerging. When I met, for example, the responsible for your cooperation there, a young lady committed, trying to bring the debate around violence against women, making sure that we can have, during all my trip, all the information to make sure that the leadership there can hear me saying that man having sex with man, sex worker, they have the rights. Things are changing, and we have to accept that because also your strong prevention culture. You have been influencing many of us, starting by myself. Since I have been appointing, I was reading I can say that I was not reading, I was studying your strategy on HIV/AIDS based on prevention, making sure that we can cut the new infection. I use many of those elements to convince leaders like leaders of South Africa. After almost 10 years of inertia in a country where you have 1,500 new infections every day, country where you have almost 1,000 deaths every day, 10 years of inertia, we have been able to change that. Today, the leadership of South Africa is completely in. They launched one of the biggest programs in the world. They want to test 15 million people before the end of the year. And they don't want just to test them for HIV. They're using HIV as an entry point to make sure that they can test for blood pressure, test for level of sugar, test for the TB, test for hemoglobin levels, anemia, and make sure that when the woman, she's found HIV positive, test air also for cervical cancer. That is the beauty of using HIV/AIDS, leveraging that one, making sure that you become not just a force sitting in the corner, but taking it out of isolation, make it a catalytic force for transforming all our health response. Making 15 million people knowing their health status is so important. But let me tell you also that it was not just results. We have been able to break the conspiracy of silence. Few years ago, we were not, no one was talking about, except few people, except a few countries like yours, talking about drug user, talking about man having sex with men, talking about sex worker. Almost people are at risk. People were refusing. Today, we broke the conspiracy. I know that since at least I've been appointed, I took that as one of my first responsibility, to commit myself, to talk about it, to the point that some of the leaders are asking me in my own continent, are you sure about what you're saying? When I'm traveling, going, negotiating for making sure that they liberate, they release people because they have been put in jail for 10 years, 14 years, because their sexual orientation. They don't sometimes understand. But I think it is our duty, our obligation, moral obligation, to be part of a society which will not be exclusive, society which will be inclusive. Against AIDS is giving us that opportunity. I want to say that also we have been able to completely change, because HIV/AIDS, the governance system. I was in, like I said, almost, or Michael was telling you, 30 years in this whole world of development. Believe me, it's because HIV, because Global Fund, that we have been able to make a shift from this concept of government ownership to national ownership by creating a public-private partnership, by making sure that civil society can have a voice, by changing completely the monitoring system, by reinforcing the accountability mechanism, by fostering public accountability so people can ask for social change. That is a major process of democratizing the society. And it's so important that people should not forget that AIDS is not just the money we are getting for AIDS. It's to make our society more just, better. And that is why I continue to believe that the whole 3-1 mechanism we have been introducing, making sure that we have better coordination system, we have less duplication, the resources is aligned to national priorities and objectives, by making sure that we have less reporting mechanism. Instead of having 20 mechanisms to report, we have only one. And make sure at least we have only coordination mechanism. All of that help us to save money for people, not just for the sake of saving money. AIDS help us also to change the delivery system. I want to take time to just say all of that. The delivery system, the alternative approach system, the architecture of implementation changed completely with HIV/AIDS. For the first time, we saw communities, we saw civil society becoming provider of services, reinforcing interface between health system and communities, and becoming also provider of technical assistance. All the delivery system has been completely changed. For the first time, we are seeing people tapping on non-conventional capacities. to expand their capacity to reach people by bringing health, community health workers, making task shifting possible. It was not at all there, because AIDS revealed clearly to the world that our system has limits, and we cannot go to scale if we are not creative, if we are not innovative, if we are not tapping to all those various service providers. Faith groups have been mobilized differently to make sure that they become more effective in terms of reaching also not just the areas where they're working, but other people. Creation of demand of services to increase the coverage has been critical, because we saw community conversation going on. I was in Tigray, in Ethiopia. I saw communities, conversation, people coming, discussing, creating space for people to understand why services made available or not used, why they should better use these services which are there for them. Changing their understanding, change completely the dynamic of service coverage there. And today, they have more than 34,000 community workers throughout of the countries, used and paid and trained from AIDS money to become today these social mobilizers and a community health worker to reach in remote areas with services. I think we have been able also in Kenya, in South Africa, to foster the link between scientific evidence and social change by taking, for example, the case of circumcision. The evidence was there, but no one wanted to use it for cultural reason. Zulu for 400 years have never been circumcised. But when we managed to get into the picture the leaders, the gatekeepers, the traditional leaders, the elders, today we don't know anymore how to give services to Zulu population in this all KwaZulu-Natal region. The queue is long. It's the same in Western Kenya. It's the same in Swaziland. It's the same in different places. We don't know anymore how to make those services available to adult and young people who are coming for circumcision. So the fostering science and social change, it helps us to think about that by saying that sometimes evidence is there but is not used. I want to say also that with AIDS, and I was sharing that with, I was in the northern part of Nigeria, in a village completely lost in some areas called Pampaida, and I met there, I was very surprised. Health worker with a mobile phone, moving around, and going to community level, finding there a woman pregnant, bleeding, sending SMS to the reference center and receiving automatically in a 30 seconds the response from the doctor. You have been trained for that. That's the moment you have to deliver. You have to make this injection, and then you have to transfer this lady to the reference center. Bleeding stop, lady transfer, life save for this lady, for the baby. And all those were happening today. Monitoring the stock out on treatment, making sure that people can be reporting automatically so services can continue for people. No interruption on services. I am happy to say that if all of that is happening in a few years, because the solidarity, because the resources in some way you have been mobilizing through your community, because the partnership you have been building, it's important for me to just say that it is working. It is working for the people. But at the same time, I'm scared. And that's why I say that it's at the same time the worst of the times. I'm scared by what also I'm seeing now. What I'm seeing for the first time in 15 years is a reduction on funding allocation by 623 million just in Europe, even though if the fastest epidemic is just happening in their backward. What I am seeing now is making me scared because people are having impression that is done, that we have 5 million people on treatment. They are forgetting completely that we have 10 million people waiting. They are forgetting that you have 33 million people infected. They're forgetting that we have 2 million deaths last year just due to HIV. They're forgetting that we have 16 million women infected, that we have 850,000 women dying every year due to HIV. So I'm very scared because any reduction on funding will be translated into reduction of services which are made available today to the people. And that makes me scared because I'm seeing the risk for us to transform this universal hope we have been creating for those 5 million people and more people who are waiting for those treatments into a universal nightmare. Because we know that if we stop the treatment for anyone, 6 months later, most of them will start dying, particularly in the poor setting. And we have to remember ourselves, the minorities who look like myself in most of those places will not die. They will continue to have access to services. But the money you mobilize to help a global fund is going to the majority of the poor people who don't have voice, who are not privileged like I am. And those people will not be able to come back to you to tell you that now, since you stop the funding, I don't have any more access to my treatment. They will die in a very silent way. So for me, as the Executive Director of UNAIDS, I'm very scared about that one. I'm scared because also when we are going through this whole change, when the world is asking us to almost normalize the fight against HIV/AIDS, what I am saying, unfortunately, instead universal access for most at-risk population, what I am saying is universal obstacles. 80 countries with homophobic laws in the world today, 10 of them having even a death sentence for someone who has a different sexual orientation. We have developed part of the world like Eastern Europe, Central Asia, with a huge opportunity to stop completely the epidemic, but still continuing to have laws which are making drug users criminal. Most of them hiding themselves. More than 70% of the new infection occurring there are happening amongst those people who use drugs. I just said that makes me scared. That is at the same time a moment where we can completely say we have been having all opportunity to change the fight against HIV/AIDS, and that's what we are seeing is a prejudice, is a growing stigma, is a criminalization with a different type of law which are not just acceptable. I want just to say again, if you want, that it should not stop us. The only things which must continue to make us believing that what we are doing is important is what is happening amongst those voiceless. For me, it's so beautiful when I am in Abuja, in the hospital, when I'm meeting someone who told me, 10 years ago, I was dying. I was on my deathbed, and with less than 20 CD4. And today, look at me. I am a peer educator. I am contributing to the social change in my country. And I'm married. I have 2 kids who are HIV negative. That is the face we need to keep. Because that face is the face of hope. That face is a true victory against adversity. And I want you to continue to think about those people who will not have a chance to meet, but those people who truly believe that we are making a difference. That's why I think we must recover, our sense of outrage. I think we need to not accept that the world will continue to have 7,000 new infections every day. I think it is for that reason, in Vienna, I call for reshaping completely our AIDS response. And I think this process of reshaping should begin with a new vision. I know many people will say, again, Michel, if you know him, he's a dreamer. But it's true, I am a dreamer. I was going to school without shoes. And, all the people around me were not having shoes. When my mom was putting the shoes, I was taking that out and I was putting in my bag. When I was coming back home, I was putting my shoes. And my mom was saying to my dad, this boy is so nice, his shoes is always clean. But, today I'm Executive Director of UNAIDS. And if it was not the dream, how? If it was not a better redistribution of opportunity, how? If it was not certainly a luck and a social justice somewhere, how? And that's why I believe on the vision of a 0 new infection. We need to go for 0 new infection. I don't see tomorrow morning it will happen, but it will happen. We need to go for a 0 discrimination. Society which are built on exclusion is not sustainable. We need to go for inclusive society. And that means 0 discrimination. We need to accept that it's possible to have 0 death due to AIDS. We are seeing already, like I said, 0 new infection happening with a mother-to-child transmission in many parts of the world. 0 new infection. Babies born without HIV. And it's possible. Let us make this dream a reality. And that is the vision which I want all of you to help us to deliver on it. Because we want nothing else than that one. We want that because 0, from my point of view, requires a few things. First, is a paradigm shift in our way to do the work. First is to bring the prevention revolution, making prevention our motto, making sure that this prevention revolution is built around 3 pillars. First is our young people. You have 1.2 billion adolescents today. What are you telling them? We remember, few years ago, infections was amongst MSM at the beginning, and they were the one who have been able to demonstrate that we can go to scale with a prevention program. And today, it went full circle. Again, infection is growing. Even in your own country, it's growing amongst those groups. In US, in different parts of the world. Because if we ignore this 1.2 billion adolescents, if you think that they don't need sexuality education, they don't need to have access to universal sexuality education, which will not deny them from understanding that you have a different sexual orientation, which will not deny them to understand that some people are using drugs, which will not deny them to understand that sex workers are there, which will not make them feeling that the world is different than what it is. I think you will miss completely to create an opportunity to equip them with a skill, with a knowledge, which will make them actors of change, which will make them also capable to negotiate their sexuality themselves. And that is not happening just because you have a PhD. I remember being in Uganda, UNICEF representative, and one of my policy advisors, she was a PhD. She came to me, she was crying, and she told me, I know that my husband is positive. And I know that he will never accept that he's positive. But I still have sex without protection with my husband. I cannot divorce. I cannot ask him to protect at least myself, because in my society I'm seen as a good couple. Very respected one. I have a big kids. Thanks God they are not positive. And this lady, probably in the end of the road, she's also positive now. What we are seeing is a growing infection amongst stable partnership couples. Most of them, more than 40% in some part of the world, most of them become discordant couples. The husband is positive and the wife is not. So for me, it's important to equip young people with skills. It's not a diploma. Diploma could not help her to negotiate her sexuality differently. And it's impossible. You could have all the PhD in the world. And that's why young people need to be in the center. The second pillar for me is gender inequity. It's important to reflect on the role of the women in the society, to look at and to just think about what Chinese are saying. If they are representing the half of the sky, why to ignore them? And make sure that violence against women are stopped, making sure that we invest on girls' education, making sure that we create opportunity for women. That is so critical in the prevention programs, is for me key. And the third one is the human rights issues I was talking about since I was starting. So I think that will help us to bring a proper prevention revolution. And we can start that already, like I said, in Shanghai, in all the big cities. Why not to say that by 2015 we don't want new infection in Sydney? Why not? You have been able to almost stabilize, reduce the number of infections. You have been controlling through all your prevention. Let us say Sydney will be one of the countries, cities with a zero new infection. Is part of a dream I want to be seeing, you know. And the second change is the change on a treatment paradigm. To be honest with you, what I'm seeing today is not sustainable. I'm seeing a limit on whatever we are doing. The costs are rising. We are moving from an approach which is based on molecule 1, molecule 2, molecule 3, molecule 4. Even countries like Brazil, who have been introducing what we call a constitutional law to make treatment free for all the people in need, they are already in rescue mode because they are having more than 1,000 people on molecule line 3 of treatment version 3, which is costing almost $19,000. So coming from high, we went to low, and we are going back to high. It's not sustainable for no countries. So it's important for us, and that's why in Vienna, I call for treatment 2.0. Because this treatment 2.0 means what? It means a simplified treatment. It means a simpler drugs, which can be certainly giving less resistance. It could be more resilience on resistance, which you can administrate for longer time, not just for 4 years, 3 years, 5 years, and then moving to another mode of treatment, but which can be also administered by a less complex health system, community worker, others. So we make it less difficult for the people to own their own approach. So it is for me the way to democratize the problem solving, making sure that the people can be able themselves to own a little bit this treatment approach. And also it will help us, if we manage to reduce the cost, to have a combined molecule, to bring a big pharma and others in the game. It will help us to save, to expand the coverage first, and to reduce the number, and I said the number of deaths by almost 10 million from now to 2025. And it will help us to avert certainly the new 1 million new infection every year if we manage with this less costly approach, more easy to manage to reach the people in need of treatment. That could be bringing a big change. The other things I personally feel which is very important for us is to start thinking about sustainability. I came from Papua. Almost 100% of people who are on treatment based on resources coming from outside. So, and it's not just Papua. In Africa, you have 95% of the people on treatment they are on treatment based on resources coming from two sources, Global Fund and PEPFAR in a majority. So we have to change completely the paradigm. It's important now also to start thinking about shared responsibility, to start making sure that mutual accountability, to start helping the countries to have what I'm calling sustainability transition plan, to make sure that they will not be just people you are putting on treatment, will not be on treatment based only on one source of financing. it's obliged us to start thinking about also innovative financing mechanism, more sustainable funding, more predictable funding. It's making me so scared. And also I know Michel Kajashkin probably address you here. But, to have a fund to every 2 years to come for getting replenishment and not knowing if you will have money and knowing that you have a responsibility, moral responsibility, because you put millions of people on treatment out there and you know that their life are hanging in the balance, as will depend of goodwill of key donors, is very difficult. So I think for me is a time to also believe that no one alone can be able to resolve any global emerging issues today. We saw that with financial crisis. We are seeing that with climate change. We are seeing that with many others. We need shared responsibility. We need to use again this opportunity of AIDS to change the paradigms of development relationship, bringing more mutual accountability. That doesn't mean that we are saying that Mali will be able to pay everything tomorrow morning, but it's important. If I am president or prime minister of Mali, when I am putting a Malian on treatment, and I know that those people will be on treatment for 30 years, for 20 years, for a life, I need to start thinking about from where these resources will come. Is critical and is a genuine question we need to raise. And I think lastly, this big reshaping will also help us to think about integration, taking AIDS out of isolation. Like I said since I came, it's not acceptable that the virus and the bacteria can work together to kill someone, and we are still fighting in a separate way with the TB office there and HIV clinics there and others, and we are not capable to bring a proper integration. I think that integration to deal with co-infection, TB and HIV, knowing that 500,000 deaths, which is a quarter of the total death, are due to that integration, is a missing link. It's so unacceptable that we continue to have those services in different places and not making that more cost-effective. And we know that it is two diseases, but it's only one life. So it's important for us to make sure that this integration can work, and this reshaping is about that. It is also the same thing when we're talking about mother-to-child elimination. When I said that I don't want any babies, any places I'm going, I'm saying the same thing. Because I want in 2015 that we will have no baby born with HIV. And when I'm saying that, it's not just for the babies. It's at the same time for keeping the mother alive. At the same time is to start linking reproductive health, continuum of care, thinking about this lady before she become infected, when the vulnerability, how to reduce risk factors which are there, violence against her, and is about also system building, is about for us is reproductive rights, is about child health. So is how we use that one as an entry point to deal with all those issues. And that will make us more cost effective. We will leverage resources which are made available to produce broader health and development outcome. And for me, that is the objective of this all reshaping. I was trying to talk about it since I've been appointed. And again, people will say that I love sharing life stories. I was in Lesotho and I met a young lady. She was around 21, and she was sharing her personal story, and she told me I can share it. And she was in a happy marriage. She was pregnant, and she went for her antenatal clinic visit, and she found that she was positive. She came back home, and she shared that news with her husband. She said, maybe you need to go for your test. The husband went, and the husband was negative. When the husband came back home, the first thing is that you don't stay 1 second more in this house. You have been sleeping around. I don't want this baby to come in this world. I want you to go for abortion, and I will do whatever I can. And so this happy marriage became for her a torture, a tragedy, suddenly. And of course, she left. She met mother-to-mother group, and they helped her to have access to services. And she got the baby, and the baby was negative. And I saw the baby, and I was very happy. But she was still crying, because she told me, I'm missing my husband. I love him. And I know he never gave me time to even talk. And I would have loved to have him here with my baby, because I know I never had extramarital relationship. Never. But I remember when I was 15, I was raped with my teacher. Maybe she was HIV positive from that day, and she was not knowing her status. She discovered her status because she was pregnant, because she went for this test. Those are the type of situation we are all facing, and there are certainly multiple of those situations out there, but they are all in some way telling us that what we are doing is important to continue to do it. And I want to thank you and say again how much I appreciate the work your country is doing, the leadership of your country, and I hope the 0.5% you have been announcing to reach for the ODA will be happening with government you will have soon. And I am sure that for the replenishment of the global fund, you will be an advocate for me to continue to make this message heard by your leaders and your politicians. And I want just to end, Michael and Bill, if you allow me, by one request. This country need to remove travel restriction for people who are resident. We don't need that one. This country is so respected outside as the country who is showing leadership on human rights, and having this restriction is not needed. China remove it, USA remove it, and I'm hoping Australia will remove it soon. Thank you very much. Thank you very much. Thanks, Bill.
Well, Michel, what an amazing address. You have presented us with an incredible case, an incredible argument. It's a case for us to be proud of and optimistic about, as you called it, the leveraging effects of the HIV epidemic. But you also presented us with a case to be very worried. HIV/AIDS really globalised health issues when it emerged, and one of the things that you caution us about is that when the rich world, when the developed world suddenly gets its own HIV/AIDS problem under control, there is a very real risk that it will lose interest in this particular issue. So I thank you. I thank you for your vision. I thank you for your passion. I thank you for your humour You've done us all a great honour to come along today and to speak with us. Thank you very much. Ladies and gentlemen, can you please join me in thanking Michel Sidibé once more.